And joining us to talk about your health is Dr. Shana Ntiri, assistant professor at the University of Maryland School of Medicine and medical director of the University of Maryland Greenebaum Comprehensive Cancer Center's Baltimore City Cancer Program. Doctor, thank you so much for joining us.
Thank you so much for having me here, Jeff, and thanks for getting all those titles. And I know there are quite a few.
That was only half of them, I believe. So it's Breast Cancer Awareness Month, and this is a condition where awareness and early detection really matters.
Absolutely, yeah, you're absolutely right. That's why there is October Breast Cancer Awareness Month. I think it's important for folks to know that getting screened in order to facilitate early detection of breast cancer really is key. If a woman is diagnosed with a breast cancer early on, her chance of surviving and having a high quality survivorship certainly increases. And also, the earlier cancer is diagnosed, the less complicated cancer treatment can be. So,
what do you see as the barriers to more people getting screened more often?
It's a great question. I think one is what you've already said, is just awareness, people knowing that it's something that needs to be done. Another is the fact that people are just busy. There was a survey that was done in Baltimore City a few years ago, and believe it or not, the number one reason that people said they didn't get their breast cancer screening done was they just didn't have time for it, or they were taking care of either older parents or children. But I think there are also specific populations where we see disproportionate numbers of individuals who are getting screened. And those individuals tend to be from racial and ethnic minority groups, and also individuals who are underserved. So thinking of persons who do not have insurance and therefore don't have regular access to health care. Knowledge of the need for when and how screenings should take place. And some people too just have a fear of getting screening done. I have a lot of patients that come in and say, I know I'm supposed to get this, doc, but I think the test is just too painful. I don't want to do it, or I don't want to do it because I'm scared of the information I may find. So there are a lot of barriers that exist, but these are not barriers that we can't overcome.
Let's talk about some of those barriers. Cost. Is
Sure.
help available if somebody doesn't have health coverage?
Absolutely. There are quite a few resources. We're fortunate here in Maryland and Baltimore City specifically. As you mentioned in my introduction, I'm the medical director for a program called the Baltimore City Cancer Program, which is a community-based initiative of the University of Maryland, the Comprehensive Cancer Center there. And we actually just celebrated our 21st anniversary in August of this year and provide no-cost screenings to individuals in Baltimore and immediately surrounding area who either have no insurance or who don't have enough insurance to receive screenings. And we offer services ranging from outreach and education, so making sure we go out into the community to let folks know that screening is important, why screening is important, how screening is done, and where they can get it done. And then we can pay for those services to be completed. In the 21 years that we've been in existence, we've completed over 38,000 cancer screenings. Those are breast, cervical, and colorectal cancer screenings. But the majority of our work is done in breast cancer screening, and we've diagnosed over 160 individuals with cancers. And we're proud to say that most individuals who come through our program are cancer survivors, and they're thriving and doing A-OK.
You mentioned the idea that people are worried about what a medical test might turn up.
Sure.
And that's a deep-seated, not unrealistic fear. How do you address that when everybody knows somebody who has had some form of cancer or other?
Yeah, I mean, I think there are different ways that you do that. If I put my family doctor hat on for a moment, I think, just having conversations with a patient. When you ask that question, there's a specific patient that comes to mind for me who was ultimately diagnosed with cancer, who was treated at our cancer center, and who was doing very well. But she had symptoms that I think she knew indicated she probably had a breast cancer. And she was really worried about what testing would show, what would happen after she initiated testing. And I think really allowing her to set the pace and the tone of what was done helped. She wanted to make sure that she essentially had some control, that she didn't do things that she didn't want to do. And so as a family doctor, just having those individual conversations. I think likewise within the Baltimore City Cancer Program, we really try to provide wraparound services. So when individuals go to get screened, we have community outreach workers that will attend appointments with patients. So if they have any questions or concerns, there's someone right there. We certainly can walk you through what the test is, what to expect, so people aren't surprised. Ultimately, I think one of the things that we say too, mammogram is not the most comfortable exam for some people, but it is a quick exam and it's an exam that could save your life. And so just putting it in that perspective, I think is helpful for folks to get the test.
Has the technology changed there at all in terms of, basic X-ray mammography versus some sort of MRI or three-dimensional scan? What's happening there?
Sure, that's a good question. Yes, the technology has certainly changed. Medical technology is always advancing. And so it is still a form of X-ray, but there is a 2D mammography and the 3D, or almost like a holistic, a 360 view of the breast that can be done. Those are still the primary screening modalities. There is breast MRI that can be used for an individual who may be at higher risk because they themselves have a personal risk of breast cancer or a strong family history of breast cancer. But the actual technology in terms of how the test is done, meaning that the breast tissue has to be put on a plate and compressed so that we can see it, that is essentially the same.
Who is at a higher risk? I mean, who needs to start their screening a little bit early?
Yeah, so an average risk person, most individuals will start screening at the age of 40. A person who is at higher risk, it can be for different things. Oftentimes people have heard about the BRCA or the BRCA1 and 2 genes. So these are genes that can be carried within families that put a person at an individual at higher risk for developing cancer. And so if a person knows that they have a gene like that, they would work with a physician, potentially a genetic counselor, to talk about when screening should initiate. Also, if you have a family history of a first-degree relative in particular, and I always say the easy way to think about a first-degree relative is a person that you can touch on the family tree. So your parents, your siblings, or your children. And so if you have a first-degree relative that's had a history of breast cancer diagnosed early, you would want to talk with your doctor based upon the age at which that person was diagnosed, whether or not you would increase or you would initiate screening at an earlier time. So there are a number of reasons that a person might be at higher risk. Those are some of the more common reasons, but really the best way for a person to know if they're at increased risk is to talk to their doctor or to talk to a physician.
What impact did the pandemic have on the overall screening of the overall population? I'm wondering if, early in the pandemic, nobody was going anywhere, certainly not to a doctor's office, which was full of sick people. So my question is there a backlog of people who maybe didn't get screened, and all of a sudden you have a wave of it, and then you find a bunch of things that need to be investigated, and the specialists who do that, are they super busy right now?
Yeah, again, a really important question, because what did COVID not impact, right? COVID has impacted every aspect of our lives, and cancer screening is no exception to that. In the first couple of months after the initial diagnoses or the initial word, I guess, of COVID or the pandemic being out, cancer screening rates were down as much as 80 to 90%. So there really was a significant impact. You're absolutely right. People weren't going to get screening. We weren't necessarily encouraging people to go out and get screening either. What the impact will be ultimately, time is going to have to tell. But there are some estimates that if you look over the next 10 years or so, that we expect to see increases as much as 10,000 deaths from just breast and colorectal cancer alone because of the COVID pandemic. As for backlog, I think initially there may have been some of that. We're fortunate. There certainly have been efforts across the state to make sure that stakeholders, from primary care physicians to the Maryland Department of Health to our major academic institutions, our insurers in the state, our radiologists and those sites as well are kind of working together. And so things have happened such as weekend hours and evening hours to ensure that people are getting in. But I can tell you anecdotally at the Baltimore City Cancer Program, we have had women who come into our program this year in particular who delayed screening, delayed follow-up, and are being diagnosed with later stage cancers. So we'll see. But that's one of those things that we're going to need more time to do. But certainly for any person who's wondering, is now a good time to go in and get screened? Absolutely. The facilities are there, appointments are available. And if you're having problems, that's a good reason to reach out to a provider to have them help you facilitate and get yourself scheduled.
Well, what should women know about the role for breast self-examination, and has the role for a clinical breast examination changed?
Yeah, two really good questions. So in medicine, we follow guidelines from different organizations. In the setting of cancer screening, we think about the American Cancer Society as one potential organization. The United States Preventative Services Task Force is another organization that provides recommendations. Previously, there had been recommendations by various professional organizations that women should do self-breast exam, and actually those recommendations no longer exist. Why did they change these recommendations? The reason was that women would find changes in their breast that created a lot of anxiety that were not ultimately cancer, led to testing and biopsies that we found really didn't need to be done. And so with all of these things, it's always a balance of risk or harm versus good and benefit. And so the recommendations for self-breast exam really are not there. I will admit, though, that as a family physician, I do talk to my patients about knowing your body, not just your breast, but your entire body. And so having a good understanding of what normal is for you, so that if there's ever a change, you're able to identify that change and say, I know this is a change. I do think that's important.
And Doctor,
in terms of
please go ahead.
No, I was going to say, just in terms of clinical breast exams, it's similar. There had been recommendations for clinical breast exams, and those recommendations really aren't there anymore. If a person comes in and has a concern, that's a different question. If a person comes in and says, I think I found a lump in my breast, or I've had a change in my skin, or I feel something in my armpit, we're definitely going to do an exam. But to do the clinical breast exam simply for screening, the recommendations, there are still some organizations that would recommend it, but a lot of the larger organizations no longer make those recommendations.
I was going to compliment your hope button on your lapel.
Oh.
It's a great message, beautifully done.
Thank you. And I have to tell you, some residents that I work with gave me these buttons, and I was very excited about them. So said I was going to wear one today.
Very good. Dr. Shana Ntiri, University of Maryland Medical Center. Doctor, thanks for the time. We appreciate it.
Thank you so much. Thank you.